Thank you so much. Ladies and gentlemen, every once in a while, a generation is presented with a challenge and an opportunity. And for me, this happened way back in 2015. I remember it was a rainy day when I was working with my friend back home. She expressed that she wasn't feeling well, but we continued making stories, and eventually we forgot about her initial comment. When you reached at home, unfortunately, the illness got worse, and it was during the night. Now, this might not be a big thing in other countries, but in my country, this is a big thing, because the village where I stay in is actually 4 kilometers away from the district hospital that had the capacity to meet her medical needs. So we all were stressed at that time, and we did not know what to do. I remember people going to bring traditional herbs to see if she can be helped before morning, where we could take her to the hospital. But unfortunately, my friend passed on that night. This left a lot of trauma in my heart, but it also marked the beginning of a new journey. Ladies and gentlemen, my name is Emmanuel Samwel, and I'm here to present Primetel. So, before I go to Primetel, let's look at Tanzania's current context, where we have only 53% of the population accessing basic healthcare services, and they spend up to 10% of their disposable income in accessing basic healthcare services. Additionally, doctors to patient ratio is unmatching and is way below the WHO standards, and healthcare workers and healthcare facilities are highly skewed towards urban area, leaving the rural areas unattended. This is not also to mention that the investments made in the healthcare sector have continuously decreased, and to this moment, 40% of the funding comes from foreign aid, which is indeed dangerous. So, ladies and gentlemen, I am here to present a new dream that would save a lot of people like my friend. These dreams come by the name Primetel. And Primetel is a telemedical application that provides diagnostic, prescriptive, and consultation healthcare services to people living in rural areas of the country. So it's basically an equitable telehealth application. Now, you might ask, what is the uniqueness of Primetel? We have all heard of this traditional solution. Some of you maybe have even used some of them. Now, let me articulate very clearly what we stand for as a company and as a project. First of all, we take pride in the ease usability. Primetel is customized in local dialects so individuals can engage with it more easily, and they can be able to understand and navigate the application with little or no complications at all, given their thorough understanding of the language. Additionally, when we come to disability, we are bringing in the application the most needed features. We are looking at things where a patient, for example, can be able to receive healthcare tips. We are looking at personalized patient database. So these are some of the things that we take pride from, and it actually distinguishes us from existing solutions. Again, when we go to the aspect of accessibility, our solution is actually accessible both online and offline. And at a very minimal price, a person can be able to access a full spectrum of healthcare services. We are also looking at an aspect of it being useful. I mean, as I mentioned before, I come from a village where the nearest hospital is 4 kilometers. What if individuals could get medical help at their own houses? Moreover, in their own fingertips. That will actually reimagine the whole equation of access to healthcare services. So this is basically how it works, as I mentioned. A patient, first of all, will get introduced to Primetel, and then they'll make a decision that, yes, this is something interesting, and I'm going to opt for these services. Once they have made that decision, we are going to take those data, the personal data, we're going to put it in our database. This is important for current and future consultations that happens in our application. After that, after collecting the patient's information, we're going to do patient-to-doctor matchup, where the patient will get the right doctor who is able to meet their medical need. And from there, we'll be able to provide what we call the post-service follow-up. Now, ladies and gentlemen, get me on this very well. The conventional healthcare systems actually have treatment process that end at the doctor's office, where after you've got your services, that's it, until next time when you're sick. But with Primetel, the treatment process actually begins after you have left the doctor's office, because we will follow up on you, we will work with our patients all across all milestones until full recovery. So these are the target audience. As I mentioned, they live in rural areas of all ethnicities. They actually fail to access high quality healthcare services. They prefer more personalized healthcare services as opposed to generalized healthcare services. And they stay in rural areas, although we also seek to expand to urban areas given the power of technology. So these are the realities of the country at the moment, the economic realities. People in the country, actually more than 25% live below the international poverty line. And also, the country itself does not necessarily, the healthcare sector does not necessarily contribute a lot when it comes to the GDP. And this is where a need for locally made solutions comes in, where we'll be able to produce our own medical care solutions, and therefore we will be able to contribute directly to the GDP of the country. Now, 63% of the population do not have medical insurance, so they spend out-of-pocket payments every time. So this is attractions. We've been able to conceptualize this incredible idea in 2021. We've been able to meet various experts around the world and talk to them about the idea. We already have a working app and website, and we are currently just waiting for the green lights from the Ministry of Health to actually launch this incredible solution. So here it is. Also, this year we were able to conduct a forensic performance test, and all things are in check. As I mentioned, we're just waiting for the green lights from the Ministry of Health. These are the stakeholders that will be engaged in the process. We do have the Ministry of Health, the doctors themselves. We do have the local government that will help us spread the word about Primetel. We also have clinic owners, and lastly, we do have patients. These are the primary stakeholders without whom we will not be able to operate. So let me take you through the user journey, right? And this is actually I'm very passionate about this aspect of the articulations that I'm making. So first of all, a patient will be attracted after seeing the advertisements. As I mentioned, we do have local leaders in our community, we do have a website, we do have the application. These actually serve as marketing channels, right? From there, a person will start, actually when they see the advertisement, they will look for it because they are actually not feeling well, they are sick, and they need immediate medical assistance. Some of the barriers that we foresee our potential customers to have is that they have poor tech literacy. Now when we move to the second leg of the journey, a patient will take a step and look at the details on the website. What is Primetel? What is this? They will start being curious. So in that process, they are developing eagerness, but they also seek more information before they make their decision. Now at this stage, usually, there is a lot of hesitation. Should I opt for Primetel? Is there something better? But I can guarantee you, they will not find anything similar to what we are offering. The third leg of the journey is on the sign up. Here they are already very assured that this is definitely what I'm going for. And they have developed a keen interest. Now one of the challenge maybe is on the aspect of pricing, but we have been able to mitigate that through availing compassionate subscription plans that our customers can actually subscribe for. And the last leg is when the person finally makes the decision we have all been waiting for, opting for the services and then subscribing. Here we'll assure them of the medical journey that is very comprehensive and that assures them of full recovery. So this is our business model canvas. As I've articulated before, we do have the distribution channels website and the application. Some of the key metrics we'll be using to measure our performance is in the aspect of access. We seek to improve access significantly to basic healthcare services. Now, some of the revenue streams that we will be using is mainly through the subscription plan. We also seek to enter partnerships with other medical clinics within the country that can help us with laboratory and pharmacy services. So this is from the testing that we have already conducted. We did embark on a field testing activity, and I will tell you for a fact that it was very insightful and interesting. Some of the things that our potential customer raised were in the aspect of the language, where the current website is developed in English and they are unable to understand most of the things. So that is a very positive feedback that we are going to actualize. But on the other hand, more than 53% of them actually said, it's okay, we're willing to pay for the service the way the current applications look like. That was a very big insight. On the other hand, also, we did have at least more than 70% of them saying that they are willing to share their medical data with the application after being taken through the back end of the website and also the back end of the application. So these are the areas of further development. We do need to work on our security. As a medical app, security and privacy is actually key. So we seek to build a very robust application that meets most of the medical security requirements, including the personal data. We also want to improve access, where we are going to be working to develop a USSD application that helps us with accessing basic healthcare services, especially in rural areas. So these are the implementations timeline. Ladies and gentlemen, this is a big project, and sometimes it takes a village to implement this project. And so we were very deliberate when it comes to planning for this implementation. The first 2 months will actually be only on planning. How do we enter the market? Where are the touch points that we want to improve? What are the pain points that we want to address when we are entering the market? And then we will go ahead and begin our registration in March. By registration also, once we are doing registration, we will also be adding more staffs. As of now, we do have 2 doctors, but we understand that we will need more doctors because the population that we are going to serve is of 6 to 1 million. So we'll need enough doctors for that. Also, we'll be setting up the offices and also our tech infrastructure, such as the servers, and we will also have a tech department that is equipped with recent technologies in order to provide the safest medical practices. So this is the relationship of this project with the 4th Industrial Revolution, and this is where future thinking actually comes in. This project displays future thinking very well, because when it comes to the future, we are currently embarking on the 4th Industrial Revolution, which is an aspect that brings together integrated technologies working to address the most pressing challenges. Therefore, Primetel, being a digital applications, only translates to our compatibility with the whole global move to 4th Industrial Revolution. We will be leveraging data and machine learning in order to ensure that we are capturing the pain points of the customers, and also providing them with the most efficient medical practices. Additionally, we seek to interlink our medical databases with those of other clinics, and also with those of other globally trusted sources, in order to ensure that we are actually being more accountable and we are being more reliable when it comes to the data storage of our future customers. So these are the impacts. After I've mentioned all of it, it is apparent that this is indeed a transformative project and will have a lot of impact. So when we talk about the short-term impact, bureaucracy will be reduced to 0 or to very little, right? Because with this particular application, you don't need to go and line in a hospital to wait for service. Basically, you just book your appointment, and at that specific time, you'll have a practitioner attending to you. On a medium-term basis, we will be able to maximize affordability of healthcare services, because we are eradicating out-of-pocket payments with our compassionate subscription plan. And on a longer term basis, we will improve our healthcare accessibility by at least 53%. This is very important because at the end of the day, we founded this particular solution with the sole goal of improving access to basic healthcare services in rural areas of the country. So these are also the other side of the impact, where I've divided it into the 3 P's. So for people, we're increasing life expectancy and providing high quality healthcare services. We are also going to be making profit, which will help us perform our corporate social responsibility. We understand that we exist in a community that has needs. Therefore, some part of our corporate social responsibility will be us going out and addressing those needs. Also, for the planet, we'll be going on a paperless mode because it's a digital solution. Therefore, we will pose little to zero harm to the environment that we are operating in. So these are the budget to implement the product. So when we move to the next one, we'll realize that we will only need around $17,000 to initiate the operations. This amount goes into the various aspects of the operations. So we're talking about staffing, we're talking about constructing a USSD application, we're talking about running the infrastructures of the office and the like, and also significantly improve the tech infrastructures that we will store in order to save the data of the patient. So these are the projections. This shows when we'll be able to break even, meaning when we'll be able to meet the investments. So during the first year of operations, once we just register 3,000 users who will be paying $15, we'll be able to break even. And then, as you see from the next graph, actually, our net worth, our annual net worth will continuously increase, and the company is actually projected to grow by 7% per year. This is very interesting, especially to the people who are funding the project, because you do not want to fund something that brings loss. So behind every incredible idea is an incredible team. And I am humbled to have this incredible team of hardworking individuals. I do have 3 doctors on board who are going to be starting the operations once we register. She has experiences over 3 years, and she currently practices at a school. She's a school doctor. She's also a hospital doctor with 4 years experience, and here is our psychologist. So thank you very much for listening to me. I understand that indeed initiating a big dream requires us to have big hearts, and I do hope that you enjoy it, and I look forward to your support in championing high quality healthcare services for people in Tanzania. It has been a blessing. Thank you.